Yeah, so the clinical implications are difficult at the moment. There's a lot of discussion going on, especially when it comes to, we have agreed that the early detection and the higher sensitivity of other or new techniques is really relevant for the patients, and they will not get any harm from an earlier treatment. On the opposite, the opposite is the case. We think that treating them earlier will be beneficial for them. After treatment, we don't actually know what to do with residual disease. There's a huge topic and a huge debate about minimal residual disease, which is also very important, and we know that no minimal residual disease like negativity is good, same as with the focal lesions. No focal lesions left is also good, but we don't know if there are focal lesions left in PET-CT, for example. We don't know what to do with it. Should we go on with treatment? Should we even change treatment? So at the moment it's unclear, but there are trials ongoing that address this question to say, okay, do we have to change treatment if a patient has residual disease after their kind of standard treatment that was planned for them?